decisions that Queensland will be taking to protect Queenslanders and to continue to keep Queenslanders safe. From the outset, can I say that we are in a public health emergency, and we have been in a public health emergency since January the 31st, and we need to continue to do whatever we can to keep Queenslanders safe. So I want to talk about a couple of issues today. The first one is that from 1 a.m. tomorrow, if you are a New South Wales resident in Greater Sydney, please do not come to Queensland. This is very similar to what the Victorian Premier also announced today. Secondly, if you are a Queenslander and you are in Greater Sydney, please return home quickly. We will allow you to come back till 1 a.m. Tuesday, but you will be required to have a test and to quarantine at home. Thirdly, and this is a message to all Queenslanders, we need to be on alert. I know a lot of people are out there enjoying holidays and getting into the festive spirit, shopping, and there's a number of things I'd like to talk to Queenslanders about today. Firstly, as the Health Minister and Dr Young stressed yesterday, we have concerns about positive samples of sewage testing in North Cairns, in Townsville, in Cleveland and the Gold Coast. If you have any symptoms whatsoever, even if they are mild, please go and get tested. That is absolutely important that Queenslanders do that. Now, we are having some issues with our pubs and clubs and cafes across Queensland. The majority of people are doing the right thing, and it's wonderful to see the QR codes and people are logging in. And also, like going to different surf clubs or whatever, people have got the electronic devices where you put your driver's licence in and that's being recorded. We are very concerned when we went to contact trace people at the Glen Hotel. There was illegible handwriting and we weren't able to get hold of everyone who was there during that time. That is not on. It is simply not on. So we are giving a very clear message to our pubs and clubs and cafes right across Queensland that you'll have 72 hours to get your house in order. And that means you must have QR codes or you must have electronic devices in place. Otherwise, you will be going back to the 1 per 4 square metres and people will not be able to stand up and enjoy their drinks. So please get your house in order. As I said, the majority of people are doing the right thing, but people now have had months to get their house in order, and we are in a serious situation, so that means we must be able to contact trace at any step in time. So please, this is really important because it's going to protect everybody. Also, everyone's out and about Christmas shopping, and we're seeing reports today that, billions of dollars are being spent in the Queensland economy. That's fantastic news, but we do need people to keep up with your social distancing. We need people to make sure that you are doing your hand sanitising, and if people aren't doing the right thing, leave the store. Leave the store and go somewhere else. But we absolutely need people to do the right thing during this point in time. Now, why are we making these decisions? These decisions are being made to protect Queenslanders and to keep Queenslanders safe. And what we are seeing in New South Wales is of concern. And when the New South Wales Premier says she's on high alert, we are on high alert. So these border measures are necessary. They are necessary because Queenslanders over the past 9 to 10 months have done a remarkable job. And no one wants to see happen in Queensland what's been happening around the world. And you only have to see what's happening in the Northern Hemisphere, where people in London and New York and other parts of the world will not be travelling much this Christmas because of COVID cases. And of course, today we only had 2 new cases of COVID in Queensland, and they were in hotel quarantine. And I'm not going to allow anything to destroy our tremendous effort that every single Queenslander has worked hard to achieve. Finally, can I say to anyone who has come from Greater Sydney over the past week, please go and get a COVID test. I think that'll be peace of mind to you and your family and peace of mind to every other Queenslander as well. So thank you for everyone for the great work. I want to thank Dr. Young for her advice today. The Deputy Commissioner will also talk about the measures that will be put in place. Of course, we've got measures at airports. There will be checkpoints that will be put in place across our borders, and we are please asking people to do the right thing. And if you are from Greater Sydney, now is not the time to travel to Queensland. We love you. We want you to have a peaceful Christmas at home, and hopefully in the months to come, we'll be able to welcome you back to our wonderful Sunshine State. But now is not the time. We want to contain what's happening in Sydney and New South Wales, and we don't want to see outbreaks happening here in Queensland. So I hope Queenslanders understand the strong messaging and the strong action and the strong decisions that I've had to take today, but we're doing it based on the health advice, and it is not dissimilar to what other leaders are doing also around the country. So I'll hand over to Dr. Young to say a few words, and then the Deputy Premier, the Health Minister and our Deputy Commissioner.
So as of 1 a.m. tomorrow morning, Greater Sydney will be a declared hotspot. Now, Greater Sydney includes all of Sydney, and it goes south down to Wollongong, Wollondilly, the Blue Mountains, Hawkesbury and the Central Coast. So that is the area that the New South Wales Premier has put restrictions back into place. So we're taking that same area, and it will be a declared hotspot as of 1 a.m. tomorrow. But we will allow any Queenslanders to return home for the following 24 hours, so until 1 a.m. Tuesday, and get tested when they come back to Queensland and go into home quarantine. If they have a home that is safe and suitable to quarantine in, of course, to go into quarantine in their home for 14 days from when they left Greater Sydney. Anyone else will need to apply for an exemption, as usually occurs. So for compassionate reasons, essential workers, so forth, will need to apply for an exemption to be able to come into Queensland, and then they will need to go immediately into hotel quarantine. I would say that very, very few exemptions will be given, as is usually the case, but of course we will look at those. This is important because we have seen a continued escalation in the numbers of cases in Sydney, and here in Queensland we have removed so many of our restrictions, so we know if we were to get one case there was a real risk it would rapidly spread. Now, we could well get a case, and I am very concerned about those 4 parts of Queensland that have had positive sewage results. So that is Northern Cairns, Townsville, Cleveland and the Gold Coast. We don't test in Brisbane because we know we'll get positives because that's where our quarantine hotels are. But some of those other areas, there are not rapidly explainable reasons why there are positives there. So I am concerned that we potentially do have people across Queensland who are active COVID-19 cases. So it is really, really important. If you have any symptoms, please come forward and get tested immediately and isolate yourself till you get a result. If you've come from Greater Sydney, so you've been in Greater Sydney 11th of December onwards, could you please make sure you get a test and isolate yourself till you have a result? These things are really important, so we pick up the first case in any cluster. And anyone who went to the Glen Hotel on that 16th of December, please could you come forward, because there have been a lot of fantastic people who have come forward who weren't on any of the lists that the Glen Hotel gave us, and they've come forward because they knew they were there. The lists were incomplete, or some people had written out their names and we couldn't decipher what they'd written. It is really, really, really important. I cannot overemphasise it enough that when you go into a restaurant, a bar, a club, any place, that you must leave your details so we can rapidly contact trace you. It's now the 20th and we still haven't got hold of all the people who are at the Glen Hotel on the 16th. And that is a real risk, because if there's one of those people's positive, they're out there in our community potentially spreading the virus. So we have to go back to all of those fantastic things we were all doing earlier on. We've got to make sure that we leave our details. We've got to make sure we come forward and get tested if we have any symptoms. We have to maintain that 1.5 metre distance wherever we can. If you can't maintain the 1.5 metre distance, put a mask on. All of us need to make sure we've got a supply of masks so that we can rapidly use them if we need to, if we have outbreaks in Queensland. If we do all of this, we can get through this outbreak again, as we did with all of the previous outbreaks. I know it's tiring. We've done this all before. We don't want to do it again, but we need to. We've got to keep all of this in place until we're able to roll out the vaccine to every single Queenslander who's able to have it. Thank you.
Well, thank you. So the message is clear for those people coming from New South Wales to reconsider their travel plans, particularly from Greater Sydney or the Northern Beaches, because you are not allowed in Queensland without an exemption and you will have to hotel quarantine. For those Queensland residents, you can return in the next 24 hours and self-quarantine in your home residence after getting tested. After that, you will also be required to hotel quarantine. We also have been advised that there are now 15 close contacts in Queensland who have been in contact with people who have tested positive in New South Wales. So that's gone from 11 to 15 today, and New South Wales are assisting Queensland in getting those details. We are contact tracing those individuals. We will contact them, ask that they be tested, and they will also have to go into quarantine. But my message beyond the travel arrangements of people from New South Wales or Queenslanders returning from New South Wales is that it is time that we reset our behaviour in our community. We want today, the 20th of December, to be the reset trigger for Queensland. Let's not wait until we have community transmission again before we act. COVID is as contagious today as it was at the start of 2020. And in fact, some countries like the UK and Scotland are reporting that there is a new strain of COVID that is even more contagious. So although Queensland has lifted many restrictions over the last few weeks, it is important that we remember that the most important measures must continue to be taken until we have a vaccine. That is social distancing, hygiene measures, and checking in to venues. That is why we are asking all Queenslanders and those visiting Queensland to reset our behaviour. Queensland has done remarkably well, and we want to thank everyone for helping us keep us safe. Let's keep it that way. So today, we will initiate a blitz of businesses in Queensland leading up to Christmas and over the Christmas period to ensure they are proactively ensuring customers and patrons are checking in. It is not acceptable that businesses are just hoping that their customers and patrons have checked in. It is their responsibility to proactively make sure that before people take their seats at venues or they take orders at counters, that they have checked in. Also, we are noticing that some venues have no longer got markings on the floor for social distancing, or that their patrons are ignoring those markings. So let's reinforce our social distancing again, and implementing hygiene measures such as sanitiser being available. We are asking businesses such as supermarkets, and particularly at this busy time where everyone's out shopping for Christmas, to reinstate their measures such as staff greeting customers at entrances, to encourage good practice such as wiping down shopping trolleys and using sanitiser. So businesses, cafes, restaurants, clubs, pubs, supermarkets should have a staff member greeting people as they come in and ensuring they have checked in and that they're using the sanitiser. The Premier has already announced that venues have 72 hours to move away from paper-based registrations. everyone has had sufficient time to set up some electronic means, whether it's the normal registration in clubs or RSLs or using a QR code. But paper registering is not sufficient. It takes too long and people are not giving correct details or their writing is not legible. We need to move to electronic means of recording people's details so that we can trace very quickly. Stop handshaking. Cough or sneeze into your arm. Wash hands, sanitise regularly, including wiping down surfaces such as shopping trolleys and shopping baskets. A good test, if you are a business, is are you using less sanitiser now than you were a few months ago? Because you've got more customers and more patrons than ever before. So you should be using more sanitiser. So businesses should be looking at whether their customers, their staff, are actually using sanitiser and making sure that they're increasing those practices again. In addition, our compliance teams will be out in force, not just monitoring businesses, but for those people who are self-quarantining at home. Again, we thank you. We thank you for having to stay home and separate yourself from other people in the household, as well as making sure that you do not allow visitors into your home while you are self-quarantining for those 14 days under a formal mandatory direction. We thank you for that, but our compliance teams will also continue to do what they have been doing since early this year, which is they will be texting, they will be phoning, and there will be random checks that people are at home and complying. So let's all do our part and let's make sure that Christmas 2020 is a safe and happy one for everyone.
Thanks, Premier. Obviously, the escalating situation in Sydney is very concerning, the increased number of cases as well as their geographic spread. Our objective, our sole objective, is to avoid another wave of COVID-19 here in Queensland, to avoid another round of the kinds of harsh restrictions and lockdowns that we experienced earlier in the year, that Melbourne has only just made their way through, and that Sydney is heading into now. And if we're to avoid that, we need to do two things. First of all, we need to greatly reduce the number of people who have been potentially exposed to the virus in the Greater Sydney area from coming to Queensland, and that's why this hard border closure is so important. It will greatly reduce the number of people who've potentially been exposed who will be in our state, and those who are in our state will be in home isolation or quarantine. So that's incredibly important, but it doesn't completely eliminate the risk, and that's why our social distancing and the other measures that the Health Minister has outlined are so important, so that if somebody who's been exposed to the virus does get to Queensland, that we can isolate them if possible, if not have accurate contact details to assist our contact tracers to identify anyone who has been exposed. And with those two measures, we hope to ensure that we don't get an outbreak here in Queensland. These decisions aren't taken lightly. We know that just before Christmas they'll greatly impact on many people's plans, but this has been a year in which Queenslanders have made many sacrifices to keep themselves and their communities safe, and this is one more necessary sacrifice to avoid an outbreak here in Queensland.
Thank you. Deputy Commissioner.
So just to give you some idea of what's happening at the moment, in the 44 hours from 4 p.m. on Friday, we have met 87 flights from Sydney, checked 10,760 passengers and placed 108 persons into quarantine in Queensland. As you've heard, as of 1 o'clock tomorrow morning, we will move to a hotspot regime for the whole of Sydney. As it stands now, anyone that's entering Queensland from New South Wales, and this includes people coming across the road borders, must have possession of a border declaration pass, irrespective of where they reside. So if they're coming into Queensland from New South Wales, they require to have that pass. How it will plan out is that coming out of the hotspot area, they will have a Q pass, which is a quarantine pass. And our officers at both the airport and the road borders will determine whether the person is eligible to go into home quarantine, as explained by the Chief Health Officer, or whether they will have to go into mandatory self-paid hotel quarantine, both for 14 days, as explained by Dr. Young. What you will see also is in the next 24 to 48 hours, increasing checkpoints on our road borders. We'll be implementing them immediately as best we can. We have planned for this. I anticipate they'll be up relatively quickly. So anyone that's in Sydney now thinking they can drive through to Queensland and slip through, they will probably find a checkpoint by the time they get here. So what we're looking for is people to really be compliant with the regime and make sure they do that. Unfortunately, we've seen in the past 2 days, 2 people that have been placed in hotel quarantine have breached that, home quarantine. So just to clarify, people placed in home quarantine, 1 person out of the Northern Beaches and 1 person who was a member of an international flight crew have not abided by their hotel home quarantine order. We will check. So they were found to have breached those orders by compliance checks by police. So we are checking. So anyone that does go into home quarantine can expect to get visited during the 14 days. So please abide by that. As always with our road checkpoints, we understand that this will cause delays. We understand that this causes stress for people. The messaging is very clear. Please understand what's required of you. We will try to make it as streamlined as we possibly can. We will give as much messaging as we possibly can, but we need people to plan ahead and not travel unless it's absolutely necessary. Thanks, Brent.
Thanks. Happy to take some questions.
Premier, can I understand, does that mean you're putting in place some sort of hard border again if you've got checkpoints coming up?
There's going to be checkpoints, and then we'll be looking very closely at what's happening in Victoria and what's happening in New South Wales over the next 24 to 48 hours as well. So if people are thinking about coming from Greater Sydney to Queensland, can I urge you not to come, because police are going to be there in force checking.
I guess what I mean is, what is the checkpoint? Do we see police like we saw only a month ago?
We'll have checkpoints at this stage, and like I said, we'll be watching. Hope you're not doing that, Dan.
No, okay.
Well, it's good everything on there. All right. So there'll be checkpoints at the moment. So the police will be there randomly intercepting with the view of putting in place harder border closure measures depending on what happens in the next 24 to 48 hours in Sydney.
If the lists from the Glen Hotel aren't complete, how do you know how many people are there, and how will you be satisfied that you've traced everyone?
Well, we don't. And that's the whole point why we have made that strict direction today, that there will be, over the next 72 hours, the opportunity for cafes, clubs and pubs to get everything in order. So what we've said very clearly is that if anyone was at the Glen Hotel on that date that the Chief Health Officer said, please go and get tested, and a lot of people are coming forward and getting tested. But it just goes to show that people need to make sure that they have these measures in place. It's very simple to fill in the QR code. It's very simple to put your driver's licence in a machine, and it's all recorded. It's not acceptable for patrons to come in and not leave their details. So everyone's got to play their part here, folks. So please do the right thing. You are helping not just yourselves, but you're helping the whole community.
Will that business be facing fines?
They're doing, as the Health Minister said, there's going to be a blitz happening as well. So yes, they can face fines.
But that specific business, you've identified that they didn't accurately record everyone.
Well, that's a matter now for the health department to look at that. Yeah.
With the Queenslanders, when does the 14-day home quarantine kick in? Say someone flew back this morning, do they have to home quarantine?
I might get the Chief Health Officer to address that. Thanks, Dr. Young.
Thank you, Premier. So anyone from the Northern Beaches, that's already, because the Northern Beaches has already been declared a hotspot, needs to go into hotel quarantine and stay there for 14 days. As of 1 a.m. tomorrow, Greater Sydney will be declared a hotspot, but we are allowing Queenslanders to have 24 hours during which they can come back, and they will go into home quarantine, if their home is suitable, go into home quarantine and stay there for 14 days from when they were last in Greater Sydney. After that, everyone, whether you're a Queenslander or not, goes into hotel quarantine for 14 days. And if you're not a Queenslander or someone permanently relocating to Queensland, then you need to actually apply for an exemption for one of those reasons, so a compassionate reason or essential workers, etc. You won't be allowed if you're simply coming for a holiday.
What rules are currently in place for airline crew flying to Queensland, particularly from overseas?
Yes, so at the moment, airline crew can quarantine in crew hotels. There are around 6 of them in Brisbane, and there are a number elsewhere in the state. Or if they've got a home because they're based in Queensland and then fly overseas, they can quarantine in their home. As of Tuesday morning, all international airline crew who don't have a base in Queensland, a home that they usually use, will have to go into one of the government-run, police-managed hotels in Brisbane.
The crew member who breached quarantine, were they quarantining at home? Were they
Yes.
Is it still appropriate to have people have that option if people are going to breach it?
So I am writing to that airline to show cause why the staff in that airline shouldn't have to go into hotel quarantine.
What about more generally? Do you think it's time to revisit that rule?
No, I don't think it is, because in most cases the airlines are actually tougher on their staff than I would be. So they ensure compliance, they ensure that's all managed. So I prefer not to say. I would prefer to write to them first and ask them to show cause why this person did what they did.
Was it an Australian airline?
No.
In terms of the quarantine, I think it was yesterday there was a restriction in place for people coming from Greater Sydney or the Central Coast
Yes.
to undertake a test, and then once it's clear to go out. Why is it different to 14 days as opposed to waiting for that first test?
Right.
So why are people coming from overseas and having to wait 14 days, but only have to wait for the results of the first test?
Right. So yesterday the risk profile was different. So we've now seen in New South Wales increased numbers of cases, and they've started to see seeding of cases outside the northern beaches and clusters develop. So the risk profile has significantly increased. So that's why Greater Sydney will be declared a hotspot from 1 a.m. tomorrow morning.
Ms. Young, what's suitable home quarantine? Do they need to have a wing to quarantine?
No. It's more about who else is in that household. For instance, we wouldn't want someone going into a household where there are elderly, vulnerable people. So it's about talking to the person. Are there other risk factors in that household? For some people, they choose to go into hotel quarantine because they feel that their home isn't suitable. And we've done that many, many times over the last 10 months. When nurses went down to Victoria, for instance, to assist down there with their response, a number of them asked to go into hotel quarantine when they returned because they didn't feel it was safe to go into their own home to quarantine.
Just another question, if you're coming from regional New South Wales, is it just the border declaration pass at the moment?
Yes, that's correct.
The 15 people that New South Wales contact tracers have identified as being in Queensland, have they all been contacted now? Do they all know that they're close contacts?
Yes, and they're all being tested, but I don't have the results back yet.
And do you anticipate that more people who have been close contacts of New South Wales cases could be in Queensland?
That is possible, and that's why I'm very, very worried about those sewerage results. So if I could repeat those results again, so they're in North Cairns, Townsville, Cleveland and the Gold Coast, which when we think about it are actually tourist areas in the state. So I am concerned that there are people from Sydney or the northern beaches who have gone up to those areas in the north or down to the Gold Coast, and I need them to come forward and get tested.
Would you consider some kind of mandatory testing blitz, particularly in those places, to randomly test people in the population who may be asymptomatic?
No, we've not found that useful. So I need people who've been in Greater Sydney to come forward and get tested. But I don't think it's useful to just randomly go through the population and test people who are asymptomatic. It's really about people with symptoms or people who've been in an area that there's increased risk of transmission.
Given the hotspot declaration comes into effect from Sunday.
1 a.m. Monday.
On Monday, so the border declaration passes with people being told to give it about 3 weeks Is there any way that process can be sped up? Or like,
It has been, and the vast majority of people are getting their responses within half an hour.
Ms. Young, given your concerns about the potential for COVID in these states, what about dancing in pubs and clubs? I know we just lifted it last week or the week before, but seeing plenty of social media last night of people dancing pretty close to each other. Is that a concern for you?
Yes, it is a concern. So if we were to get community transmission within Queensland, then we'd have to review all those restrictions. No different to what New South Wales is currently doing. So their Premier's come out and has gone back in terms of all of their restrictions to the 1 per 4 square metre, no dancing, etc., and has put that in place for Greater Sydney. We would have to do something similar if we get community transmission. But my hope, of course, is by doing all the things that we've just discussed that we won't get community transmission in Queensland.
Blitz on venues, is that police who are undertaking that?
Between police and Justice and Attorney General's Department, and also our environmental health officers from Queensland Health.
Could maybe ask Mr. Golczewski, what is that blitz going to look like? What are the potential penalties for venues that are found to?
Well, the penalties remain the same as we've had all through it. So the Chief Health Officer's directions carry with them a penalty should someone breach them. For instance, border breaches, false declarations of $4,000, thereabouts. The other breaches are $1,334 for anyone that disobeys them. And of course, the corporate ones, it escapes me at the moment, but it's significantly more. So it's quite a heavy penalty for that. And we've seen right through the response that we've had to issue somewhere around 2,700 fines already. So, and it's consistently still happening. People are still doing the wrong thing, not listening to the advice we give and not following the directions. So as you've heard from the Health Minister, we're going to really ramp that up, and that will be done collaboratively. There's a standing task force that looks after that across government, coordinated out of the Justice and Attorney General's Department. But police have a very strong role in that, and as you've heard, in particular for us, those persons that have got home quarantine orders will be very closely monitoring whether they're abiding by those. Okay.
Yeah, sure.
Do you think New South Wales is crackdown is hard enough given the explosion in cases?
That's a matter for New South Wales, but can I say a couple of things about that? Look, first and foremost, we've come a long way in Queensland, and I don't want to see all of Queenslanders' hard work go backwards. That's why we're taking these tough measures. Secondly, if we start to see even more cases come out of New South Wales in the next couple of days, I think we should have a National Cabinet meeting. I really think it's going to be at that critical situation that we need to convene as a National Cabinet to talk about these issues, because it is of national significance.
When was the last National Cabinet meeting?
A couple of weeks ago.
In that regard, what would you hope to achieve from that?
Well, I think what can be achieved is that that the premiers and the territory ministers can all be across all of the issues. We're getting great briefings from the chief health officers, but I don't think we want to see what happened in Victoria happen in New South Wales, and I definitely don't want to see that happen in Queensland. So I'm just saying, if things escalate over the next couple of days, I think a National Cabinet would be worthwhile. But also too, now's the time. I know a lot of people are on holidays. Everyone really needs to listen and to take the advice. We've got a lot of visitors to our state at the moment that are enjoying our Queensland lifestyle. We want that to continue. And the only way that can continue is if everyone is doing the right thing. So please leave your name, your contact details at different venues across Queensland. As the Health Minister said, keep up your social distancing, and we have to take these really strict measures to continue to keep Queensland's lifestyle the way it is. Okay, thanks everyone. Thanks.